All right, everyone, welcome to another episode of What's What BR. Today we have a number of guests joining us here from Our Lady of the Lake. How is everybody?
Good, thank you.
Doing good.
Yeah, so we've got a room full. Unfortunately, I'm not there to join you, but why don't we start running through? Maybe Dr. Dunbar, if you can start, kind of introduce yourself, what you're doing, and then everybody kind of a little bit of who you are, what you do, and where you fit. So.
Yeah, well, I'm Trey Dunbar. I'm the president of Children's Health at Our Lady of the Lake. So certainly have some responsibilities at the hospital, but also have responsibilities outside of the hospital and some of our community practices, our specialty practices, and obviously our developmental and therapy group. I'm a neonatologist by training and still practice. Been practicing for about 20 years. So I just take care of sick babies in the NICU is really my area of practice when I'm not doing administrative duties.
Wow, that's interesting. I didn't know they had a specialty that just went down into the NICU. I spent time there myself with my kids. So,
Goodness, yeah.
Oh, who's next?
Oh, I'll go. I'm Dr. Stephen Felix. I'm a developmental pediatrician. I've been in practice for 27 years in developmental pediatrics. I did 7 years of general peds before that. So I'm specialized to work in children with developmental disabilities of one sort or another. I've been here at Goodwood for 11 years, working with the team here, and now looking forward to working with McMains.
There we go. And we know we've talked a few times. How about yourself?
So I'm Ann Heinrichs. I'm the director at Children's Developmental Center at McMains, which has changed our name a little bit. We are now part of Our Lady of the Lake Children's Health.
Yeah, we'll have to touch on that as soon as we get one more.
I'm Dr. Tracy Olivier. I'm a pediatric neuropsychologist. I was born and raised here in Louisiana, went away for training, did most recently my fellowship at St. Jude Children's Research Hospital. I have a specialization in working with kids who have neurocognitive disorders, and I oversee the neurobehavioral medicine division here at the Pediatric Development and Therapy Center on Goodwood. So that's a little bit about us.
There we go. Well, I appreciate all of you for making some time, and I usually end with this. I usually tell people they have more important things to do than to talk to me all day. So I'm just going to clear the air on that first. So appreciate y'all jumping in. Y'all definitely have more important things to do. But to touch on what Ann was just talking about, Dr. Dunbar, this is a new partnership. This is new, or kind of how it works. What exactly, what does it mean for developmental medicine here, in our area and even beyond, as far as, kind of, this is a big deal, whether maybe people don't realize it, but this is kind of a big deal.
Well, I think, we would all agree that it's a very big deal. Our Lady of the Lake Children's Health, as Dr. Felix mentioned, we've been doing a lot of care in the developmental space, for 11 years or so. Dr. Felix is being a little humble, but he's kind of built our program associated with Our Lady of the Lake and brought in a good number of professionals so that we can really focus on children that might not be meeting their developmental milestones for a variety of reasons, help diagnose them and treat them effectively. And this center here at Goodwood gets children sent from all across the state to be evaluated and have treatment plans set up. We are extremely blessed in Baton Rouge that we've had the McMains Center for years, serving the community for almost 70 years. Doing some of the same things, but also doing things that the Developmental Center at Goodwood maybe hasn't specialized in. By bringing these two groups together, we're going to be able to provide have a bigger bench to be able to provide care for these children here in Baton Rouge and throughout the state. We're going to be able to complement each other well and become a group that has a broader portfolio of offerings. And to be honest, we'll be able to grow more quickly, provide more services as a larger group than we could have individually. So to me, I think this is a huge partnership, a huge step for children's health as I see it in Baton Rouge and beyond.
Yeah, tell me, and what brought this? You guys have been in the community for an extremely long time. You guys have been serving. What, I don't know if is there a particular, is there an aha moment or, hey, now's the time? What made this, you've been at the helm, for a while, what was that said, hey, we need to do this? Because what it sounds like, from what you're saying, Dr. Dunbar, this kind of analogy I used in this scenario, 1 + 1 doesn't equal 2. The two of you combined, this is a 1 + 1 = kind of 4 thing as far as services. And what made it feel right, or that time right for you?
The conversations actually began, back in like 2013, even me being executive director. And we really waited for the Children's Hospital to be built. Now, with so much going on, it kind of became a win-win situation for our families, for the kids in this community to be able to provide more services. And really, at the end of the day, that's why we all do what we do. It comes down to those kids. But it also was a growth move for McMains because we could do more and be able to reach more children if we connected to a larger organization, but even more so, people who had similar views and who cared. And the people sitting at this table with me exemplify that.
Absolutely. It makes sense. And I guess, if we kind of dive, down into that a little bit, maybe, Dr. Felix, what is it? We talk a lot of this stuff, and I think sometimes people get into it's where, when you talk to anybody in their profession, they talk, it's jar, we say, programs and offerings and help the children. But if we got down into the, meat of it, what exactly is that for somebody who just doesn't know?
Well, I mean, what is there here, or what is developmental medicine? I guess.
What you guys are doing, kind of what makes it, sure. When you've combined forces, is it something, now we can do this and somebody else can't do that, or we're just really, really good at this?
Right. And developmental medicine is a complex area. We work with children with developmental disabilities, our two groups, and developmental disabilities are a group of disabilities of disordered brain development. Occurring from conception through, people vary on this, but 10, 12, 16 years of age. About 15% of children have developmental disabilities of one sort or another. If you look at the population in Louisiana, if there's 1 million children in Louisiana, 15%, that's 150,000 kids right there with developmental disabilities. A huge population that has varied needs. And the needs aren't just medicine. We're maybe saying developmental medicine, and there's a certain component of that. You need to diagnose the kids. You need to say, okay, this kid has cerebral palsy. This kid has intellectual disability. This kid has autism. And then sometimes you say, this kid needs surgery. This kid needs this GI procedure. This kid needs this pulmonary medicine referral. This kid needs medicine to help his behavior, okay? But it goes beyond that because these children also need a broad selection of therapies, speech, occupational and physical therapy to meet their varied disabilities and motor skills, language skills, hand skills. They need testing to see where their skills are. That's where someone like Dr. Olivier comes in to say, okay, this child has weaknesses in this area. This child is weak across the board. This child has very specific gaps in their abilities. Needs help with social work, with other additional behavioral therapy that social workers or therapists or applied behavioral analysis can provide. So these children have a wide variety of needs that require a team to address. And that team approach, that they have at McMains and that we have here, we're both doing that. But it's kind of like you said, that 1 + 1 isn't 2, that us working as two separate sites, that's fine. But when you bring together the groups, there becomes a synergy. For example, we have the neuropsychology piece here, which they don't have at McMains. but they have an augmentative communication piece at McMains that we don't have here. There are a lot of kids with, for example, autism that have severe communication impairments, and they need some way to help them communicate. And that's where augmentative communication comes in. But they may also have very complex cognitive profiles. Their thinking skills are very complex, some of them, and they need that piece. So now with us working together, we can work together as a team to bring all that together instead of saying, which I have up to this point, oh, you need augmentative communication, go over to McMains, or you have this complex seizure disorder, you need neuropsych testing, go over to, the Goodwood campus and get tested there. It all becomes one team working together. And when you have that interdisciplinary approach, care is so much improved. Again, it's not 1 + 1 is 2 or even 4, it becomes 50, because now it becomes a much more integrated, holistic approach where the child is cared for by a team that can, even on a day-to-day basis, walk into each other's room and say, hey, we need this, hey, we need that. What do you think about this? This medication isn't working. What if we try this instead? So maybe that's a long answer to say that, there's a broad variety of needs. Working together, bringing together the different services really serves to elevate care for these patients. And this is going to be a collaboration that doesn't exist in the state at this level outside of
That's kind of where I was, thinking along the lines as you were talking. And I think, maybe Dr. Olivia, if you can tell us a little bit about, it would seem, even though we've got some separate roofs, but in theory, we're all underneath one roof, kind of now at this point to where I refer to them in my office is what I call like the office drive-bys when, somebody pokes their head in, it's like, hey, you got 5 minutes, and it turns into an hour and a half. It's just, you kind of get just shot without, but from a holistic approach of taking care of a child, it could be literally those sometimes called like red light thinking, where you're able to walk into the office and go, I had this thought, I had this idea, and you've got the group right there, and it's not calling to another business or like, do you have time for a meeting, or just kind of pushing someone and saying, it never all shows up. And I don't mean this in a negative way, but it never always shows up in the paper chart, right? Or the electronic chart. You've got to know more. And it would seem that's where we're getting this scale, that it's people can collaborate. If you're grabbing lunch with somebody, is that kind of where I'm getting the right direction?
And I think that's one of the challenges of growth, particularly in a healthcare system, is that the bigger you grow, the faster you grow, the more tempting or the more it lends itself to silos of care. And there's a variety of reasons for that. One is just the number of people that are working to provide care for a child or a patient. Then you have different locations. You have a complex medical system that takes a lot of time to sit there and document. That's something that we have have kept in the forefront of our minds in terms of this new relationship, is that let's not have silos of care. Let's do as much as we can as an integrated team, because ultimately, as Dr. Felix mentions, it benefits the patient. I mean, you can think of yourself if you've ever had interactions with the medical field to where you were sent here and there, and this person said that, but somebody else said something differently. And those things still happen, but when you have everybody working collaboratively, especially if you're down in the same hall or in the same building, it just makes it so much easier to get quicker and better care. Another thing I wanted to mention is that because of this new collaboration, like we said, there is nothing like it in the state. We were running the numbers, if you remember, Anne, in the very beginning, and we had started looking at our history here at the Development and Therapy Center and said, okay, well, how did this come about? Dr. Felix has built the program over the past 11 years, but when we looked back in old records and talked to people who had been here forever, we found out that we had started about 35 years ago. And McMains has been at least 65 years or more in the community. And so when you look at that, there's a combined 100 years of service for kids with neurodevelopmental disabilities. And we were just really proud of that when we realized this is going to be a major, major relationship.
Well, and I think it's, as we're talking, not to get repetitive, but it's that conversation to where some of this could be, a mental, that needs to be addressed, but then it goes into the physical. And so people maybe, some of these kids, one thing I wanted to talk about, was kind of on that autistic front, but maybe it makes them a little more comfortable because they can get more procedures or more treatment or more care at the same place. Does that, it kind of it's comfortable, at that point, it's like, we're used to going there. I'm used to seeing, or, hey, can you help? We've got, XYZ patient coming in, maybe they're not on your schedule that day, but you're able to just pop in and say hello because, it kind of helps them move along. It would seem like there's so many of these benefits that we can't put bullet points down and list that just happen because, of this, I guess. And what's the official, what do we call it? Is this a partnership? Is this what's the transaction, I guess, that happened?
It is an acquisition. So
Okay.
Children's Health actually bought McMains. And the idea behind that was so that we could all go into that equally together instead of 3 separate facilities.
There we go. Okay. So tell me, and maybe this, I don't know if this would be, best for you, Dr. Felix, but from we're about 20 something days away. We're about to hit April, which is Autism Awareness, month. We hear autism a lot more nowadays than we did before. I don't want to get into the whole, the medical behind it, but is it becoming more common? Do we have more kids, or are we just diagnosing more kids? And then does this help fill some of the gaps and some of the needs that some of these kids in our community need? I'm thinking the answer is yes. I'm not trying to ask a loaded question, but if you could maybe expound on it a little bit.
Sure. And I mean, is autism occurring more frequently? That's the $64,000 question. There's good data out to say it probably is. It's not just a matter that we're diagnosing it better and more. It probably does exist at a higher rate. In fact, right now, the current estimate is 1 out of 53 kids has autism. And clearly, I remember in the day when I was an intern or resident in 30 some years ago.
Be careful on this.
It's like 6 years ago.
Yeah, right. Times 5 or 6. Anyways, but I remember that we would be called down to the clinic to see a kid with autism because it was so unusual to see. And now we're diagnosing 5-6 kids a week here with autism.
Like 1 in 2,000?
Yeah, I think we were calling 1 in 4 or 5,000 in the 80s, and now it's 1 in 53. So that's about 2% of kids. And again, if you think about it, that's 20,000 kids in Louisiana. So, and to put that in perspective, if you take all forms of childhood cancers, type 1 diabetes, juvenile rheumatoid arthritis combined, autism alone is more than all of those. So it's a very common disorder. So it's probably occurring more and we just don't know why. And that's the question. Why is it occurring more? What gaps are there in services? Well, I think the big one that maybe Dr. Olivier and you alluded to are silos. There's this service here, there's this service here, there's this service here. And sometimes families are driving hours a day to get from one thing to another. And I think you probably mentioned you're a dad. Driving kids around in a car causes you to turn gray and pull your hair out to begin with, right? He's touching me, he's not touching me. Can you imagine a child who maybe is nonverbal, can't express that he has to go to the bathroom, is just melting down in the back seat, and they still have to make their appointment across town? And so one of the gaps is just the significant one is just the silos of care. The second one is there's just not enough providers. That wait times, we were talking about a wait time just today to assess kids for autism in our specific autism clinic. It's a 9-month wait list right now.
Wow.
And, the lake has been very supportive of expanding services. We've been able to do that. There are other centers around the country where a wait of 12 to 15 to 18 months is not unusual. So there's just not enough services from speech, OT, PT, developmental medicine, et cetera, et cetera. So the shortage of services is difficult. The ability to provide all the services they need, especially in one center, and that's going to be improved again, as I sort of alluded to, because multiple kids with autism have communication problems. If we can bring that all together under one roof, obviously these kids are going to get better services in one place. So they're going to be able to come to one place. And yes, it's going to be easier for them to be there and be familiar because yes, that's very important for many kids with autism that they're in a familiar place, but they're going to be able to get their stuff there. But those gaps are there. Those gaps are real and they're pervasive and they're pretty strong.
No, it sounds, and I guess this probably is, back to you, Dr. Dunbar, as you mentioned, inside the hospital responsibilities, outside the hospital, and so it's kind of put the all-star team together. And then now we've got all of this work that's going to be benefit families, but we've got to let families know, that's there. And then to turn around and say, well, this is great. And just like with any acquisition or merger, now it's like, we got to find the broken pieces and how do we fix this? And how do we listen to the families and find out, what do they need? Is that your outside the work job?
Yeah, no, I think that's entirely fair, and that's an appropriate characterization. Again, our goal at Our Lady of the Lake Children's Health is to demonstrably improve the care of kids throughout the state of Louisiana. There's only so much we can do in the hospital, as Dr. Felix suggested, from a numbers perspective. Now that we have these two organizations together, we can be very thoughtful about the process of care. I know the team today, both teams got together. There's a whole lot of discussion about process and operations, but there's more discussion about strategy and future. What does our growth look like? Dr. Felix talked about how hard it can be, how rare some of these professionals can be. I think having a program that is all-encompassing and larger will help us recruit. So I think this is just, from where I see this is just positive all the way around moving forward.
You went right where I was about to go. It would seem like, the deep history that both organizations have, McMains and Our Lady of the Lake, but then to combine that to get, and then also with the resources that I think OLOL can bring to this. Now we've got, literally, you kind of said the words, a hub for getting people, like, if this is your field, this is where I want to go, which would in turn affect all of the families here in the state, which would, may we shorten that, waiting list window, to get into it.
That is definitely the goal. Yes.
So tell me, Dr. Felix, you were pioneering this at the lake originally, right? Put this together. How does one go about doing it? It's almost like I'm trying to picture, kind of you're there and we're like, okay, we're going to do this. And it's almost kind of off to the side, putting something together and then telling people like, hey, I kind of built a department on the side and then it grew from there.
Well, I was, again, brought here 11, 12 years ago, and I think we had about 8,000 square feet back then, and we're up to about 21,000 square feet now. And we've added about 50% more staff. I mean, how do you go about it? Well, I mean, we have great partners with Lake administration that have been supporting us through the years. Obviously challenges in finding finances, et cetera, but, they've been supportive of us through the years and growing the program. I think the challenges that every place has is one, like you said already, finding the talent. We found a great neuropsychologist here in Dr. Olivier. We have some great talent here at the lake. There's great talent at McMains, but they're hard to come by. So Dr. Dunbar's comment, if you build it, they will come, right? Field of dreams, then we build the center of dreams. So people want to come here and work in it. So that's the first thing is attracting the talent. Building something like that ain't cheap. There's challenges in reimbursement. This is probably not anything new. I know you mentioned Garrett Graves. We've talked with him about this once upon a life. Reimbursement is hard. And so we struggle always to figure out how to find things and economize and make things work. How else do we make it work? Well, so we build it. We attract the staff, but I mean, we also have to fundraise because these things don't come cheap. I don't know any major developmental center. I don't even know too many minor developmental centers that don't have vigorous fundraising campaigns annually. And I know McMains has had theirs through the years. They have theirs coming up at the end of this month on the 31st. But it's just a reality. If you're not bringing money in, you're not going to be able to expand services, and you need to bring money in on a constant basis to support this work.
Well, and it sounds like what you're saying is you guys, everybody, sounds like everybody here at the table is got a role. It's almost, you got your day job of treating patients, and then you've also got to be, a business, leader of how do we grow this from a business. It's not, you can't just like, hey, we've got consultants everywhere, you can pick them up, but it's, you guys are the ones that know how it works. Scott, as you mentioned, Dr. Dunbar at the beginning, so it's in the hospital and outside, but you guys are really, it's kind of hats off to you, not only for what you're doing with the children, but also like, hey, we're also going to build a business and grow a business at the same time. And then, oh yeah, by the way, I'm going to treat patients at the same time, while we're doing this. It would seem everybody's got 2 full-time jobs at least, right?
Well, remember too, we see all children, regardless of their ability to pay and what their financial arrangement is. So that's one of the things that Our Lady of the Lake Children's Health, along with McMains, has always done. We take all forms of Medicaid, we take all forms of insurance, we take self-pay. So any child can come to our programs.
So when we talk about that, Dr. Olivia, what is the, what kind of patients and what was it, does this open the door a little bit from your side to where it's like we could treat A, B, C, and D, but we couldn't do this and this, but now we can? Are you seeing that there's more that we can do? Do we feel that we've got a whole scope, or, what is it you're seeing, with this partnership that kind of brings to the table? I guess it would seem like that would make this better.
Certainly. Well, when you bring the teams together, we mentioned there are a few puzzle pieces that we might have here at the Development and Therapy Center, and then a few puzzle pieces that are at McMain. So while most of the services that we offer are very similar in terms of the therapies, having the developmental medicine piece or the neuropsych piece here and having educational therapy at McMain, something that we don't have here, or having that augmentative communication, that just expands the scope of the services that we can provide. We talked a lot about autism, and that's one of the main clinical disorders that we see in our clinic. But when we talk about neurodevelopmental disorders, it's very, very broad. Dr. Felix mentioned it starts at conception, and these things happen prenatally and beyond because of things that happen to the developing brain. And so that might be things like a child with autism or an intellectual disability or a language delay or a motor delay, but it might also include other children, kids with cancer, brain tumors and tumors in the spinal cord and leukemia that affects the central nervous system. Or it might be the child with epilepsy who also has autism, who also has a cognitive delay, or a child with some other complex medical or genetic condition that's going to impact their functioning in everyday life. And that's why that interdisciplinary team is so important, because there are the physical aspects, there are the cognitive aspects, there's the emotional side and the behavioral side, and then there's how they're functioning in daily life. And that's not even to talk about the support that the parents need, which is a completely different bone.
Yeah, I was going to say you've got the patient covered there, but then the family, like we mentioned, getting them there, driving around. I tell people all the time, I'm an unpaid Uber driver, starting around 3:00.
Yes.
It's, and, one of the things that popped in my mind, as we talked about this, and as I was mentioning, it kind of everybody having 2 jobs, it would seem like, and this is, almost a good for you, not a bad for the lake, but it's almost, we're kind of tossing it. It would seem like that this acquisition partnership, whatever verb, we want to put on it, but that would free up a lot of the administrative type burdens that maybe you had to shoulder, or a lot of, your team had to deal with, that maybe can be lifted. And now all that energy can be focused back towards the kids or recruiting or finding. Have you found, does that feel Have you seen that, or are you
It does
getting
give
there?
it does give me a much bigger wheelhouse to choose from. You know, I mean,
Yeah.
just from HR to being able to defer back. Dr. Dunbar meets with me weekly, which is wonderful because as we've gone through this, McMains, we're under 25 employees. The lake is 20,000. So you can see the big jump there. But having that support, these two, Dr. Olivier and Dr. Felix, and I have been meeting regularly, just working through, talking through processes and all. So that support really from that end helps a lot. It does help free up. We haven't hit the free up point yet because we're still learning and still just getting our legs, our feet under us with all of this. But the potential is so great. And just working with everybody. So yes, I do think I already am beginning to feel that, and I see that coming.
You had me at HR, just to send people to HR to have somebody else to.
Not have to learn every law and research the whole topic.
I think there's one thing that actually would make things better for the patients, and I'd like you to kind of talk about this if you agree, is our electronic record. Just being able to have all the patients on the same electronic record, having them now at McMains have access to schedule online in advance. So there are some things that, just being a part of the lake has really kind of helped, I think, McMains, continue to build upon the great patient care that they've already been providing.
Oh, absolutely. I always talk about it. I'm a big data guy. And so I always use the analogy. I have dashboards that I look at for our businesses and different things that I'm involved in. It's like I have to have it on one pane of glass. I need to see all of it right there. And I think, Dr. Olivier, that's got to be a big deal, right? Obviously there's the whole, we had an IT guy before, but you got those guys that got to start like transferring data and moving it and all that kind of stuff. But to be, ultimately to have it all in one place, just that alone has got to be able to help, improve the patient, quality and what they're doing, because you're not looking for gaps, or you're not saying, go talk to this person down the street and then come back and then having to get on the phone. It would just seems like this just kind of makes sense all the way across the board. So I heard, and we mentioned it, or somebody mentioned it, you've got a fundraiser coming up.
We do. We have a couple.
We talked about money. It's not just falling out of the trucks on the side of the road. So
I wish. Still trying to find that tree, that grows the money. We do. We have something called the Cala that's coming up, but it's March 31st. But then we will also have April 24th. We have our No Such Thing bike event. Backing up to the Cala, it's our California wines and Louisiana cuisine. So we have some wine dinners coming in with that, and then wine and just celebrating different wineries that are coming in from California. We have 11 of them that will be joining us that night over at Phil Witter's property at Live Oak Arabian. So we're looking forward to doing that. Our No Such Thing bike event, all the money raised on that will go back to purchase bikes for the kids. And then we also have a canoe trip. So spring is our busy time, which goes with probably everybody else in the Baton Rouge area. But the other exciting thing about those programs, the canoe trip, the bike thing, and even as fundraisers, is that being able to offer that, we've been limited on the kids that come to us, but now we can get that word out to all of our other kids to be able to join us for our canoe trip and the adapted bikes, and get those bikes into their hands as well.
I was going to tell you, I didn't want to forget the money tree, from what I understand, is planted in Washington, because they can just,
That's why
they obviously know where it is there, because they're just spending it like crazy. So we'll have to call some people there and see if they can find it for you. Dr. Dunbar, I don't know if enough people, the fundraising, helps. And if anybody can, obviously, we can ask them to, donate, but, what is it that, if there was one thing that, you'd say, like, this is where we need help, or this is where we need some awareness, or this is what we want. Is there anything in particular that stands out to where if we just said, this is what we need, because it takes a community to do this. I would agree, if you build it, they will come, but you still got to have the people, in the community, we've always said it here, in our publication, it takes a village to raise a child. And so, is there anything that sticks out?
Well, so I'm going to answer your question, but I'm going to add a couple of things to it if you don't mind. I think being able to get the message out about the services that we have collectively, I think is important. I want people in Baton Rouge to know how high a quality of care that they have for children with the developmental delays, disabilities, autism, etc. So just for the community to be able to value that, I think is important. And I think it leads to the second thing. We talk about, yes, there is a little bit of a challenge, in paying for some of these services, and it's not unique in developmental. It's in pediatrics, and that's why all children's hospitals fundraise. I've been extremely proud of what the community's done to be able to put the children's hospital where it is. It was over 90,000 individuals that donated to help build that facility. We would certainly like to be able to continue, based on the value that these services bring to the community and the state, to extend that philanthropy dedicated to developmental care and developmental needs. Ultimately, when we look out longer term, right now we're on essentially 2 campuses. Okay. We'd love to be able to bring all these groups together physically with a few other specialties to really have a center, a physical center that could be able to provide very broad services. So that's what a lot of the team has been doing, is they've been thinking about, well, what are the programs? How do we order these? How do we prioritize? Let's put that vision together. And then, that's a vision we want to share with the community, and we would want community support to be able to build.
Is there anything, it sounds like we've kind of talked about, like, there's nothing like this else around, with the amount of resources, the amount of people, you guys have put it together. Is there some other place, and I guess I'm going with this from an angle, I guess I'll explain myself first, for the person who's maybe, watching, who is not affected, that their child is not affected, but maybe they've got a friend who says, they've got a friend who's got a child, and they hear them, it's, well, what's going on? How's, Jack? Well, he's doing this. We're going to be going to Vermont, for this, that we could say, no, don't go there. This is what, this just happened. Did you know? So is there for the person who's not, this isn't in their world, it's, like there's, certain hospital, you've heard, mentioned you did an internship at St. Jude, there's, you've heard people talk, Mayo Clinic. Is there some name that maybe if somebody was leaving town or to go, that we'd say, no, wait, no, hold, you need to go check this out?
I think we all probably have a certain center in mind. The one that's in my mind is the Kennedy Krieger Institute with Johns Hopkins. Separate, total physical building, connected. They provide a broad array of services. I believe they even have some inpatient services. So I think actually a lot of us have had connections there. So, but I think in my mind, when I'm thinking of longer term, what is a best practice or those types of things, that's the type of thing that I think about. And I'll let you guys chime in too.
No, absolutely. I think we're all on that same page.
Yeah, I agree.
Yeah, that's just, I guess not to, call them out or, I think everybody, whether it's those guys, if it's everybody's got, the children are first, that's what we're trying to help. But for somebody I just wanted somebody to, if they hear that name, to be, and they didn't know, maybe they didn't know, or maybe like McMains has been around for so long, and there's so much, you guys have done an amazing job, but it's almost just like we've said, 1 + 1 is not equaling 2 here. So if you tried it one time and was like, hey, we didn't do that, or we're traveling to go do this, or we wanted to, it's like, let's circle the wagons again and see that there's a lot more to offer.
My concern with that is that families it's less about them talking about going here or there, that they just don't know where to go. That they just they don't understand, some of the services that are out there, the resources that are here. I sometimes I even worry about some of the healthcare professionals in different parts of the state, and making sure that they understand what services can be provided here, how we can help children, with such a collection of resources. So for us, it's about, like I said, it's about getting out there and making sure people truly understand and know.
Well, I led with it in the beginning, and I still believe it. You guys have a lot more important things to do than to talk to me all day. So I appreciate all the time, and love to have you come back and, kind of how's it going? Because it sounds, this is new for everybody. This is not, we're not a year down the road. There's, like you said, we're still, I can imagine there's been countless meetings with whiteboards and people trying to figure out, well, how's this going to fit, or where does this go, and who should we contact about this? And so love to have you come back and, kind of go, hey, we put the puzzle together, and guess what? It's bigger than we thought, So,
Happy to do so.
Yeah, we'd be glad to.
Absolutely. Well, I appreciate the time, and definitely we'll have you back on soon. See, give you a little runway, make it all happen.
Thank you.
All right, sounds good.
Thanks,
Thank you
Brandon.
very much.
Bye.
Thank you.